As you can tell, it's the weekend. I'm outside doing a little bit of work, hence the sweat. But one of the things that seems to come up a lot also in this getting ready to retire is the fact that you have to have health insurance until you reach Medicare age, which I think is 65. So there's this gap. If you've been saving well and you can fiscally afford retiring, there's something you got to do for healthcare. I mean, I think Cobra you can pay for 3 years, and I think you could probably get something on the government care portal or whatever it's called. But the problem is that if you have enough financial means to retire early, that usually means that you're not going to get any kind of break on the insurance on the portal. So what do you do? Luckily, I have health care through the VA, which is very wonderful. There's a lot of bad press about them, which is probably justified in some cases, but my interactions with them have always been positive. So that's one thing. If you have VA healthcare, you got some things set up that way. And if you have it, put a comment down in the comments and let me know what you think of them. So anyways, the whole point of this is I decided to read my healthcare plan from work, and I was incredibly surprised. So I mean, I read it real good because I had to have an implant, dental implant, but I had to go to an oral surgeon because I had such an abscess. He went in, put me under general anesthesia, pulled the tooth, cleaned out all the abscess, and did some other doctor stuff. I don't know exactly. Prepped it for the implant and sent me home. So I had previously had oral surgery for about the same thing at a previous company with my health insurance. And yes, it is a dental procedure, but because he's a MD and they use general anesthesia, the health insurance company paid for it. So with my new company and my new insurance, I wanted to see if I should file a claim on it. So I got to reading the thing, and what surprised me out of everything was it doesn't cover dental at all. Even if it's for health reasons, not dental reasons. I mean, I had an abscess, had to have surgery to get the abscess out, but our insurance clearly defines that they will not pay for any of that. None whatsoever. And with my dental insurance, they paid like a whopping, I think, $1,000. That's it. That's like my lifetime limit on oral surgery and implants. So it left a ticket of like $5,000, which is why I was reading all of the information in my healthcare program. So anyways, they don't cover that. But what I found interesting is, and they don't cover any weight loss programs. They don't cover bariatric surgery. They don't carry for your Ozempic or any of those other drugs because they said in there, and they've stated when other people ask, that being obese is a lifestyle choice, not a medical condition. So they don't cover it, which I thought was, wow, it's a lifestyle choice. So anyways, continuing on, I read some more, and lo and behold, if you want and again, I'm not bashing on this, I just think it's ridiculous for my insurance company to say this, but if you want a sex change operation, they will pay for the surgery, and they will pay for the hormones for your transition. So I was like, how is that not a lifestyle choice? How's that paid for? And stuff that's a true medical emergency where I had to get the abscess out of my mouth isn't. Or the fact that I'm a little bit obese. I think what they technically call me is morbidly obese, which I'm working on. That's a lifestyle choice. So they don't cover that. So anyways, tell me what you think. Put something down below. Is it a lifestyle choice? Should our insurance cover regular regular old emergency surgery, even though it's on the jaw. I mean, the plan actually said no surgery on jaw. So, God forbid, it just is crazy. But yet, they will pay for a sex change operation, and I realize people need that too. But that does not seem like a medical requirement or necessity. So, anyways, tell me what you think. Am I overreaching or what? But anyways, that's how it all tied into retirement and looking for health care and making sure I got health care, and then looking at the health care plan at work. So anyways, put your comments below. Let me know what you think. Thank you and have a great day.